So now we're going to try and transition a little bit to trauma and coping. And these two topical areas, trauma and coping, as well as substance opioids, they sort of transect one another. And so our first speaker that will talk about trauma and coping is Dr. Irene McClatchey. She is the director of the Master of Social Work program here at Kennesaw State University. And she started a grief camp for kids and adolescents for the last 25 years. So let's give her a round of applause.
Thank you. My experience is mostly with children who have experienced a traumatic loss of a parent or a sibling. That's what I have worked with for the past 25 years outside my regular job here. So trauma means injury, and it's only the last 40 or 50 years that we have accepted that it does not only have to be a physical injury, it can be an emotional injury. So what it means is that it's a deeply distressing or disturbing experience. A traumatic event can happen once, for instance, rape, or witness somebody dying or get killed. It can also be chronic, like child sexual abuse, domestic violence, or living in a crime-infested area. And it's important to know that trauma is not necessarily what you and I think is trauma, it's what the person experiencing the event sees as traumatic. My research has shown that children who watch a parent die from cancer experience that as trauma just as much as the person who sees their parent get killed. So it's important to know it's how the person experiences it. So how does it look? The person who has experienced trauma and has traumatic stress symptoms will experience intrusions, which means that they will see in their minds what happened over and over again. And that can create nightmares, and they can become clingy. With children, for instance, this past weekend, I had three, well, they were twins, 7, and a 9-year-old who had discovered their 11-year-old sister who had killed herself when they came home from school. And the parents came for the weekend and the children came for the weekend. And the father said, this happened in December, last December, right before Christmas. He said, it was such a traumatic event, but this weekend, the weekend at camp, he said, I am happy. I am happy today because my kids are playing with other kids and they are not holding on to my trouser leg. For 6 months or 5 months, they had not left their parents' side. They, children or adults too, who have experienced arousal, experienced trauma, will also have arousal, which means that they will be irritable, they will have problems regulating their behavior, so they will act out and they will engage in risky behavior. They will experience hypervigilance, which means that they are on the lookout for the event to occur again. Again, if I go back to my campers this past weekend, a week ago, we had a 10-year-old who was walking with his dad at a picnic when lightning hit and killed his father. So he was very nervous when the rain started falling last week. And then when we heard the first flashes or first lightning or saw the first flashes, he totally broke down. So that, for him, he was expecting something bad to happen right again. then the other symptom of a person who has experienced trauma is avoidance. They will go to great lengths to avoid thinking about what happened. So, I'm sorry, but I'm referring to my kids again. I call them my kids, my campers. The 14-year-old who watched her dad shoot her brother and her mother, shot her, but he missed. He just got her arm, and then shot himself. She witnessed the whole thing, and she was at camp 3 months later, and played and said, and was just smiling and happy and said, I don't want to talk about that. Didn't affect me. Well, that was a very well-developed avoidance. And eventually, when she felt safe, she was able to bring up her feelings and emotions about it. And then the last symptom that we see in people with traumatic stress symptoms is negative changes in cognitions and mood. So they will have bad thoughts about themselves and about the world. They will blame themselves for what happened. They will have loss of interest in activities. So what do we do for people who have experienced trauma and need our help? Well, they need coping skills, and that's where I would start. I would teach them ways to deal with their symptoms. So we do that with teaching deep breathing and mindful breathing. Imagine that you've heard that is kind of a fashionable word that you hear these days, but it has shown to increase function, and kids in California, for instance, who do mindful breathing, they take 5 deep breaths in and out in the morning, and at the end of the school, their grades have improved greatly. So there is something to it. There's also thought stopping, where you teach the children or the person to stop the thoughts when they experience the intrusion. That you have to do carefully, because if you don't want to encourage avoidance. So when you teach thought stopping, you have to let them know it's only to use in situations where they really need to focus. For kids, for instance, if they have a test in school, they can use thought stopping to concentrate on the test. There's also, we teach relaxation and guided imagery. When we have taught coping skills, and this has to be done with a professional, you need to actually do what's called exposure. And that's where the person talks about the event and sort of re-experience it in a safe place with a professional. And the premise for that is that the more they talk about it and re-experience it in their minds, the less frightening it becomes. But you have to teach the coping skills first, so that when they have to stop, when they are telling their story, they are able to use those coping skills. Then the last thing we use is cognitive techniques, where we teach them to think differently, because I did mention that they blame themselves for what happened oftentimes, or they blame somebody else, that they need to change their thinking about what happened. I had a camper, we went to Virginia to help the children who had experienced the September 11 attack on the Pentagon. And we had one of those campers, he was 11. He was sick the day on September 11th, and he asked his mother to stay home with him. And she instead got grandmother to come, and he said, Mom, I really want you to stay home. And she said, no, I have to go to work. Grandma is here. She was killed in the Pentagon attack. And he blamed himself because he had not nagged her hard enough. So that's how he makes sense of the event. But so in the cognitive interventions, we talk about how he needs to, whose fault was it? It was not his fault. It were the terrorists who flew the plane into the building, and that takes some work. But those are the interventions we do for trauma.